Michael Mead still with us, do we know?
I don't know.
Okay, don't wanna miss him. Okay, so we heard from our constituents, we heard from the administration. We do have a recommendation in front of us if we wanna move at all. We don't have to do anything, but I'll open up the floor for discussions.
At this time, what I really want to do is make sure that we all have a clear understanding of what the metrics are going to be. And that we all, and it's something that we can post publicly for the parents to be able to, see as well. So we have to come to some kind of an agreement of, and I don't know if we can do that tonight because Dr. Maleko might need to confer with the nurses in order to make sure what data we're gonna have available and what they've been using when they've made the call. But I guess there's probably three pieces of information we're looking at. We're looking at the positivity rate and what are we going to use? The 5%? Is that the drop dead rate that the CDC asks for? But is that gonna be weighted with the new grade metric that they showed us tonight with, right now is at E, and what's going on in our buildings? You know, cause I assume that one metric that we were looking at included Dearborn's numbers.
It does, the matrix.
That one, yeah, so that one would kind of fold in some of the other numbers we were talking about.
I would add that we're asking parents to make a decision by Friday on
Correct.
if they're putting their kids in the virtual learning program. We need to let them know what the metrics are that we're going to be looking at so they can have an idea if they're comfortable keeping their kids in a remote setting that could go back to in person at some point, or if they just say, I'm worried about safety and I'm moving to virtual for the remainder of the school year.
I mean, I could just go back to what I said as far as recommendations. I'm saying that in order for us to consider, now it's the board's decision, but we're recommending those two the 5% positivity along with the matrix, which would tell you it's safe. Now, here's the caveat is that we understand that there may be situations in buildings that we have to look at. So we can't just say and I know we have to decide overall the district, but understand that we may have to make decisions in buildings too, whether that flows into a whole district.
Yeah, I guess right now I'm
That's
looking at the district reopening.
So I think, based on, we've received so many different datas and we're in so many meetings. That 5% positivity rate, is something that, we've done with the Learning Lab and we know CDC says it. And then the matrix now is telling us, according to the county's guidelines, which is part of the state law from the Michigan Department of Health and Human Services, which equates several metrics, and they come in with that final ranking. There'd have to be some stability over a 2-week period to then decide to go back. The issue that, and I know there were some comments earlier, I'll just say, and I think this is kind of where we're coming from this, Mr. Martin spoke and Mr. Higgins. And I think one of the reasons that recommendation is also coming in is because then remember, once you open, if the numbers go back up, again, we're supposing over a 2-week period, then you may be making other decisions again, potentially to close. So you have to consider that as well, potentially. So I'm just throwing that out there and I think that's why I'll just say, I think, the board here made the right decision at the beginning of the year because we didn't want that kind of situation where we were looking at that data.
Opening and closing,
And we could be so
opening and closing,
volatile, and I
yeah.
think you've all recognized that, and we all came along, in the summer, we were all looking at that nice July data in Michigan at the beginning when the governor came out. We were hoping for in-person instruction, and then things started evolving. We had the committee, and then we saw the data. But right now, what's on the table for recommending is we're looking at that matrix, which is multiple data sets, which would tell you, it comes up with a recommendation in the box, and then the 5%, it does equate the community infection rate, so of course you can look at the community infection rate separately if you want and pull them out, but it also is in that matrix with that they give, they're
That's what I
equating it.
thought, yeah.
They are equating it, and again, they're looking at trend data. They, in the meetings I've been in, trend data is very concerning to them, so. And they're the experts as far as the, what's going on, and we're seeing the numbers. This morning I saw nationally on the news and statewide. I think they said there's no more states that are in decline. Now all states are in either the red or in just holding, but no one is in a decline. There's like 30-something in the red, meaning 10 to 50% increase in cases.
Trustee
So-
McDonald?
I do have a couple of thoughts. One, I understand setting up some kind of framework with the matrix and the positivity rate. Those make a lot of sense to be incorporated into our decision-making. But I'm concerned about boxing us in. Okay, we say that the positivity rate has to be below 5% and we have to be D or better on the matrix. But you have to still leave room to fold in other statistics that may come, specific to the district. What if those things did fall where we would reopen, but suddenly the hospital rate is over 90%, which is hugely concerning. So I just don't want to, I think we do need to have a framework. These are the things that we definitely look at. These are the things, specific things that will guide our decision, but I don't think we can say if this and this happens, we are definitely going forward. I think we have to be able to have a little bit of flexibility because this whole pandemic, we've needed flexibility.
Trustee Lane?
We had 5 measures that Ms. Alibazi mentioned. That was the 5% rate that Trustee Thorpe pushed us a little to establish. It was between 3 to 5%. We went with the 5%. I was in favor of closing because it was 4.6, but we also had the measure of rising or falling rates. So even though it was below 5, we knew we were going into a period because we've got super spreader events. There are these political rallies being held all over. On Saturday night, I was awake listening to people having a huge party in our neighborhood till 2 in the morning. And there were more than 10 people there and they were young people. So for those reasons, I think I agree with Trustee McDonald. We need multiple measures, but we've had those measures. We had the 5 lists of things. And I would say we have to meet 3 out of 5. Then we go with the plan that we saw. Our plan is to have learning labs resume when we see falling rates below 5%. Then we resume our learning labs. Once we see again falling rates and below 5%, then a couple weeks, 2 weeks later, like Dr. Maleko presented to us, November 16th or whenever, we push learning labs to 1 to 6. And assuming a downward trend, then we talk about K to 2 starting on the reduced, the 50% capacity. And we work that plan, gradually adding students.
Okay, Dr. Mead?
Yeah, hi. I can't get my video to come up, but you can hear me, right?
We can hear you very good,
Yes.
yes.
Okay. All right, well, my preference would be that we delay the in-person instruction until 2021. I think that this is very confusing to everybody. We've heard from the citizens enough to know that they prefer safety, number one, safety of their children. And every time we meet on this subject, we hear from everybody and the citizens again. And I think it's just upsetting. I think we need stability. And I would recommend that we seriously consider staying away, that we don't do in-person until 2021. Thank you.
Trustee Moser?
Yes, I do agree that we need to really spell out the metrics, and the metrics have to have the data stated. So the primary metrics that I've heard from everybody is a positivity rate, infection rate in Dearborn or in the current city, as well as the numbers in our district. Those are the three kind of primary numbers that I see. Now, there might be other numbers that we need to consider, such as the hospitalization rate, which could be a secondary metric. In the meantime, I'm very concerned about the consistency, and especially if we're going to pull students only for 2 weeks in December. So while that's happening, I think we need to focus more on what we agreed last time and expanding the learning labs when the positivity rate is below 5%. To optimize the virtual learning platform, whether any ways that we're falling short in that, as well as to increase the parents' involvement during this time until we open. I think we need to focus on those three areas as well, while we're looking at those primary metrics and secondary metrics.
What I'm hearing Dr. Michael say is that we would have to have some kind of stability, a 2 weeks trend in the right direction. So I know the recommendation says possibly November 16th. I guess that would be what I'm hearing everybody else say. That would be the earliest that could happen. So if there's the one glitch, it's going to take us to the 23rd, which is the week of Thanksgiving. So I heard many of the educators say we need stability, we need stability, we need stability. So and I agree with Trustee Thorpe. The parents are out there waiting for us. I don't know if they're still waiting for us tonight or waiting tomorrow morning to get some kind of answers. They have some decisions to make the next few days. So I would like to kind of give the administration some kind of direction moving forward. I don't want to leave this again for another couple of weeks, what have you. But it seems like we don't want to be vague either. We don't want to be saying, okay, this is what we're going to go ahead and approve, but leave everything else vague. So I would like to hear from people. If this is the direction we're going, I heard, from a couple people saying status quo, maybe down to, let's just serve out the rest of the semester, both elementary and secondary. But the majority I'm hearing is they want to make a decision tonight, but don't want to leave it up in the air. So I guess at this point, the discussion we started to have earlier, we said, let's wait till later. What is it that we would be comfortable with? What is it that's we can tell Dr. Maleko, okay, if this happens and this happens, then go ahead and pull the trigger on November 16th or November 23rd or whatever the date is. Can't leave them hanging. That's the best way I can put it. Anybody got any ideas?
Trustee McDonald's got her.
President Beery?
Trustee McDonald, go out, please.
Well, I have a couple, excuse me, I have a couple of thoughts. First of all, I do like the idea, and we've talked several times about starting slow with the lower elementary first. So I think that is a good place to start. As soon as we're able and take a look at the metrics, the Wayne County Health Department rating, that A through E, I believe it does encompass most of the things that we've been looking at. So perhaps just as a basic metric, that should be the one to take a look at and generally follow. My understanding, I could be wrong, but I believe it has most of the other metrics rolled into it. And then if we start out slow with the lower elementary, as soon as we have a couple of weeks of level leveling off, then that would give us a chance to allow those students to return. Those are our youngest students that need the in-person as soon as possible. And it would also give us the chance to assess how that is going. But I do think, since we've been told that more than likely it will take several weeks, up to 6 weeks or so, to get everything in line for secondary, perhaps that would be a good time to hold off secondary until the new semester, and then that would give some stability to the parents, and they would know what's going on.
Thank you. Trustee Lane?
I don't think we're going to, I'm in favor, as I said, of proceeding as we've laid out a plan with learning labs, increasing learning labs, half-time K-2, then half-time K-3. I don't think that's gonna happen before the next semester anyways. We're going into Thanksgiving. So, I mean, besides expertise, we have to also use logic. Everyone is predicting, and expertise, I mean that if Wayne County's epidemiologists tell us, like they did in the last case, that they're very worried about us proceeding, then I think that I take that very seriously. But I don't think, we know we're going into Thanksgiving. We know there's already this built-in 2-week time period from exposure to lag time till symptoms resolve. So I don't see us we can start moving in the direction when we get below 5%, when we get on that matrix into the acceptable areas, and when we have a decline for 2 weeks. I don't see that happening before the next semester, but I would like to start moving that way, providing that we meet those measures.
Okay, I'm not hearing anybody argue against phase 4, which would be the secondary. Let's wait. I mean, we heard from one of our principals who would know best. And I understand the logic behind what he was saying. Yeah, probably 6 weeks would be like rushing it. So it sounds like everybody's good there. Phase 3, I don't hear any arguments against that either. That's just pretty much to be determined. That's our preschoolers. So we're pretty much discussing phase 1 and phase 2. So I guess for the high school parents, I think they have a good idea what direction we're going. But we're also telling parents that eventually we are going to get into the classroom,
As long as the numbers,
as long as the numbers
the data work.
allow the administration, AKA Dr. Maleko and his team, to make those decisions. So I do agree with the logic behind that. Moving forward, this is probably not gonna happen in November. We might get a couple weeks out of December. Is that good or bad? I mean, we heard from the educators earlier that that's probably the worst thing we can do, is because everybody's looking for stability during these challenging times. Let's see. This is what I'm gonna put out there. This is not a motion. This is what I'm gonna put out there, and we'll see if somebody will move on it, and we'll go from there. If we start with the matrix of a D or higher, that's our starting point. Obviously, when we're E, there's no moving forward. If we get to D or higher, then we look at the positivity rate, and that's where you would need a 2-week trend in the right direction. So Trustee Lane is not wrong. If this is gonna be your starting point, personally, I don't see us getting back to school until after the holidays. But, again, I wanna make sure that the parents understand what we're doing, and they need to make some decisions the next 4 days, because there's no way I'm gonna push for okay, let's take that May 30th, look where I'm at right now. This thing is getting to me. October 30th and say, let's give them to the end of the year. I think the administration will start throwing staplers at me if I say that, because I can imagine the nightmare that you would have to go through, especially the next couple months. So, this is what I'm putting out there. If somebody wants to move on it, we'll go from there. Starting point, matrix D. Okay?
Hello?
Yes,
I
Dr.
can't
Mead, go
wait.
ahead.
I think that the administration's proposal is fine.
Yes,
I think it's well thought through. I don't think
Correct.
that's the issue. I think the issue is that they can't implement it until the metrics are appropriate. And we all know that more than likely, we're going to have some poor numbers for returning in-person instruction right through January, February, et cetera. So I think the motion is that we accept the proposal as submitted by the administration, but cannot be implemented until the metrics are appropriate.
and that's what I was covering, Dr. Mead, because I heard at least 3 or 4 of our colleagues say they're sort of kind of comfortable with this plan, but we need to let Dr. Maleko and his team know, where do you begin?
Well, I
We're
thought
gonna
I
be
just
really
said that.
pushing it for the November 16th. I don't see that happening. And we could be, I mean, obviously, we're gonna be back in here on the 9th, but I definitely wanna give our parents are just, it's chaotic right now for them. They don't know what decisions they gotta make, and I was trying to defend our decision, rightly so, that, we're gonna open up schools soon, sooner or later. You need to make a decision. If you don't want your students in the classroom, then you need to make a decision to go into the virtual academy. And I think, let me just finish out and we'll go from there, Dr. Mead. With the matrix, D or higher, then you look at the 2 weeks positivity rate, has to be trending at least stability for below 5% for those 2 weeks. That will give you the green light to make that decision. If it's the 16th, if it's the 23rd, if it's the first week in December, you're gonna let these 2 numbers guide you. You
And
got a
we're-
good idea what I just
Yes,
put out there?
and the other thing is, we're still gonna be back.
That makes sense to
Oh,
me.
sorry. The other thing, just to be aware procedurally, we're gonna be back before you, in 2 weeks.
Yes,
And even if we make a decision, we can make a decision on the phase 4, but it still has to be reaffirmed every 30 days by state law. So we're gonna be in front of you to say, by the next meeting, you're gonna be well informed of, okay, if this is the plan that the board agrees to, then it does, because we're gonna have to come before you with presenting that data and saying, hey, we can start planning, because we know, okay, it's trending, but it's still gonna, with the
We
way we
still
plan
have
the
to
meetings,
vote on it,
we're still
yeah.
gonna be right in front of you as well, so you're gonna be looking, you're gonna have that data.
Are
And I know
we-
you're gonna
Sure.
get it through our
Yeah.
reports too, but so I'm good with whatever.
Are we
But I
going to
understand
start
what you're
our
saying.
our
You're saying.
phasing in
So-
at learning labs though? Is that the first phase?
no.
Or are we going to allow
I'm gonna-
Dr. Maleko to determine learning labs prior to reaching those?
I have a good idea what direction this is going, but I think
Yeah, I do
I'm gonna
too.
go ahead and entertain a motion to approve the recommendation from the administration, meaning phase 1, possibly November 16th, or to be determined for K through 2. Phase 2, 2 weeks later, whenever we start phase 1, for 3rd and 5th. Then phase 3 would be the preschoolers, and phase 4 would be the secondary, starting at the next semester. And everything that was discussed here by the team. Now, when do you kick this off? When do you start? And I hope I'm clear. If there's any questions from my colleagues, I think Dr. Maleko got it. Just for you to start the discussion, the matrix has to be D. Obviously, we can't do nothing in E. Then 2 weeks of the trend going the right direction. Just like right now, can't open up labs. If, you know,
So-
I guess,
So
We're
two
looking at
weeks
those
of D
two-
and 2 weeks
The
of below 5%?
matrix was, when it gets to D, Dr. Maleko and his team would look at the current week and the week before, and if it's trending the right way, then they would pick a date. It's not gonna happen before the 16th, that's a given.
I understand that, but I want to make sure we're all clear. Are we saying it's got to be 2 weeks? Because he's saying he's going to get that report maybe bi-weekly, correct? You think?
They said right now it's weekly, but they are looking at changing
So
it because
he
they
has to
want more
have 2
stable.
of those reports at a D level?
2 weeks, not 2 reports, 2 weeks.
Well,
So it
if
could be one
he was
report.
getting.
But it might not have been updated in the
Yeah.
second week is what trustee Petlicoff
Then
said.
moving forward, you have to wait until, so the trigger would be the matrix at D. Then
For 2
after
weeks.
that, whatever, until you get updated information. Like you can't just, as soon as you get to D, pull the trigger and,
That's what I'm saying.
Yeah.
I don't want him to get the D and then say,
Sure. Oh,
okay,
yeah.
we're,
are we clear on that?
I
Yeah.
understand
If,
what
hopefully
you're
they
saying.
keep, I mean, obviously tomorrow, we already have a head start. I think there was some information was mentioned earlier, but this week is kiboshed. I mean, that's not even
Yeah.
gonna count, so matrix at D.
I need one clarification.
Yeah, let me just finish one last time and we'll get to you, Dr. Trustee
Okay.
Alexia. So matrix at D, then look at a 2-week trend of below 5%. And it's just whatever below 5% is, 4.98 or whatever it is, that's what we're gonna call it. Trustee McDonald, go ahead, sorry.
The matrix at D and then 2-week trend, from the time that the matrix hits D, could that 2-week trend be
That would be-
retroactive to
that
the
would
prior
be-
week?
That would be Dr. Maleko and his team, that'd be their call. So if it hits D, let's
Okay.
say it's today, let's say tomorrow, because tomorrow we know information's coming, okay? If hits D tomorrow, but then, the county reports come in at 5.4, then you're looking at least 2 weeks out,
Right,
okay? So if tomorrow, the matrix is a D, and the report comes in at 3.6, the next week it's a 3.8, right? Then we can go ahead and set the date.
right.
Whatever whatever Dr. Maleko and his team decide.
No, I understand that. My question was just say, if we don't get that, if we get that report in 2 weeks, we hit D and say, next week, we were actually below 5%. Would that prior week count? I'm assuming it would if we stayed within a
Of course it
2-week
would, of
trend.
course it would, yeah, but that discussion wouldn't even, the discussion wouldn't even start until we get to the D. Trustee Lane, do you have a question?
No,
Oh, okay.
I got a
Yes, sir.
question. We keep saying the matrix and D. I don't see it on our website yet, so people are gonna wanna know where they
We're
can
gonna-
find this matrix and get a better understanding for it. So we need to make sure that's shared with the public.
Okay, so just for the public out there, they're watching now or they're gonna watch us tomorrow. We are saying that we're gonna get into the classroom sooner or later. So the decision you need to make Tuesday, Wednesday, Thursday, Friday, you got 4 days. You need to make that decision. Can we possibly get into the classroom on the 16th? Slim chance, but it's possible. So you need to make that decision if you don't want your students going into classroom to go to virtual academy. And that would be the deadline. It'd be impossible to extend that deadline. So, clear on that? Trustee Moser?
I just have a question or clarification. So when both numbers are met, are we still counting 2 weeks out?
When both numbers are
When
met.
both numbers,
Explain that, what do you mean?
so if we say tomorrow, we get the D rating and then we get a number that is less than 5%. So do we say from next week then
Well, I
in-person
mean, I
starts, or
heard that
do
the
we
nurse say the magic word, trending, okay? So tomorrow we hit D, and the positivity rate comes in like at 3.6. then there will be a conditional opening on the 16th, as long as that following week stays below 5%. Does that make sense? Tomorrow.
And we
doc-
stay in a D range, because
We have to stay in the D range.
D range,
The
yeah,
trigger is the
because-
D range.
because that's our,
Because
our
going the other
numbers.
way, it would be very, very difficult for
Yeah.
Dr. Maleko and his team. The trigger is the matrix being a D. So if last week was a bad week, this week it's going the right direction, and things are, now, if he's getting reports that there's no hospital beds available, Dearborn is just as crazy as it was back in August, stuff like that, obviously things are trending the wrong way. Dr. Maleko's not
Well,
gonna
that's what
pull
I'm
the
saying,
trigger.
that D could easily turn into an E, because it's our numbers, not, it's for
And
Dearborn
as soon as that D
specific,
turns
so,
into an E, then
yeah, it
hit
stops
the
everything.
brakes.
Yep, stops everything, okay.
that's a
just-
good question, trustee Moser. Anybody
And,
else?
and can I just comment too, the
Yes.
D, it would be the minimum, because there, it goes all the way to
Yeah.
A, but D, just so
Yeah,
that.
D or
we-
better.
we
D or
prefer- Prefer,
I can't
Okay,
hear.
trustee Thornton.
Oh, I know, I see the clock.
We're talking and focusing a lot on health. We also need to remember the education of the students. And if we are talking about going forward with two-week lag times between the different groups, we're still talking a long time before kids get back into class, and that's more instruction that's being lost. We know the teachers can't do it all. We're already saying right now to all of our middle and high school students, 3 months. The semester goes for 3 more months. They're gonna be virtual for 3 more months. They've lost half the year. So anything we can be doing, whether it's more learning labs for those kids or getting the elementary kids started, but we need to start moving forward with getting the kids back in
safely.
safely. But again, if safety
It's
is a
not a
big
race.
concern to families, take the virtual option.
It's not just families, it's the staff that's in there who don't have that option.
Some of the staff do. Some of the
I
staff
don't know how
don't.
much of the staff are gonna have an option to say, hey, look, I don't, you know, the custodians don't have that option, they can't work virtually, I mean, we've got a lot of staff that.
Custodians, parapros,
Yeah.
the kitchen.
I'm not going to just say,
Yeah.
you know, it's just, that's why this has been such a difficult decision.
As it has been for every other
Yeah.
employer.
I get that.
Okay. Are there any other questions on what I kind of was proposing to Dr. Maleko? And if not, at this point, I will look for somebody to make a motion.
I'll move that motion.
What is the motion?
The motion is, what I said, the matrix, the trigger would be a D or better. Then Dr. Maleko and the nurses and the rest of his team would look at maybe last week, this week, and things are trending in the right direction, then Dr. Maleko would say, this is the date that we're gonna start phase 1. Now, with that being said, I'm gonna find it very, very hard to believe the way things are trending right now that it's gonna be November 16th. Most likely, if things go the right way, next couple weeks, it'll be the 23rd. Now, let me throw an example out there. We get to late November, and the first possible date is that Monday before holiday break. I don't see Dr. Maleko saying, let's bring everybody in for a week, then go home, send them out for a couple more weeks. I guess at that point, if things are trending the right way, it would be whatever date that we come back from.
Why
the
not?
break. I'm sorry?
Why not?
To bring them in for a week? I'm listening to the experts. I have a lot of faith in that man that stood there and said, it would not make any sense whatsoever to bring students in for a week.
No, I'm not talking about for the middle and high school. I'm saying for
Well,
the elementary
It's
students.
still the same thing. To me, I mean, if he's, just because he's a high school principal, it's the same philosophy that, why would you want to bring him in for a week? Again, it's
At
not my
some
call.
point, they
That
need
would
to
be
get-
that would be
They
his
need to
call.
get started.
That would be, I'm not telling him what to do, what not to do. Whatever he decides, then, as long as the D is met, below 5%, last week, this week, things are trending the right way, and we have the recommendation in front of us. Did I answer your question, Dr. Mead?
Well, it seems to me like the board ought to say something about that they accept the administration's proposal and that the proposal cannot be implemented until the matrix is met.
That's
I mean,
exactly,
there's two pieces to it. One is that the administration needs to know that what they have put together is acceptable to the board. And the second part is that the administration has to understand that it cannot implement it in an unsafe situation.
That's
and if
why
I
we're
understand it
putting-
right, that's what,
Motion,
that's, if I understand it right, that was the motion that was moved. And if we're gonna move forward, we need a second.
I'll second it.
I'll second.
We have a motion, moved by trustee Moses, seconded by trustee Petrikov. Do we need to have any more discussions? Is there any more final questions?
yeah, what is the motion that Mr. Mosip has
The
put down
motion
the
is
floor?
that the recommendation from the administration that we have in writing or an email,
The phase-in
phase one,
Reopening.
phase two, phase three,
presented tonight.
yeah, presented tonight by the team. And in order to go that route, we're saying the matrix, that's what we're referring to, that graph, whatever you want to call it.
Once the Wayne County
I
community
think what
spread
Dr.
level
Mead
for
is looking for
Dearborn
is exact
is at
wording of a
level D or
motion.
below,
Yeah,
that should be the
that's the
wording.
trigger. So,
And positivity rate.
Joanne is
below
listening.
And the
what Jim just said.
positivity rate.
For
for
2
Wayne
weeks.
County.
yeah.
Yes.
Why are you laughing, trustee McDonald? I should.
No, I was just thinking the same thing. If Joanne is listening, can she write out a motion?
No, I said
Oh,
if
yeah.
Joanne is listening, what Jim said.
And it's recorded.
It's recorded, so what Jim said. With D or better, not just D or
Right.
better.
Once the Wayne
The
County community
positivity,
spread level for Dearborn is at a risk level D or better,
Yes, sir.
and the positivity rate in out Wayne County is below 5% for 2 weeks, then we are willing to move forward with a phase-in
Phase-in reopening.
reopening
Yes.
as presented by,
As presented by the administrative.
It sounds like somebody's ready for
administrative team.
January. All right,
tomorrow.
Madam
So
Secretary, if
once we've
there's
got that,
any final
yeah,
comments,
can we,
questions?
can we talk about what happens? We could do this after the motion.
Yeah, I was gonna say, we've got a motion on the table, we gotta take a vote.
Yeah, but I just want to say, after the motion, then can we discuss also what shuts down the procedure? So in other words, if the positivity rate goes back up
For 2 weeks,
above 5%,
for 2
then,
weeks.
Or we drop down
Well,
to an E.
let's,
or we drop
Let's
down to an E.
cover
Well, we dropped down
Information
to E,
item.
that's a given.
Yeah,
Dr.
we've got,
Walpole?
we've got.
We
go
dropped
ahead.
down back
All
to E,
right,
that's a
okay.
given, we shut down. Okay,
Okay, all right.
let's
All
go ahead
right,
and have
so
a
now
roll call
we're ready
vote for the motion, please.
Okay. Lane, yes. McDonald,
Yes,
Mead,
yes,
Moses,
Yes.
Petchlokoff,
Yes,
Thorpe,
yes.
Barry.
Yes, thank you, the motion carries. Now, we will be meeting again on the 9th, and we can give some more direction about what trustee Moses said. Let's do some more learning labs, let's do some more during, as long as the positivity rate is,
how we can support
yeah,
during the time that we're still
we're
virtual.
still virtual, yeah. So for the
Yes.
parents out there, if you have any questions, I guess contact your principals tomorrow. There's a plan to open up Dearborn Public Schools according to the motion we just passed. And you have some decisions to make. If you do not want your students in the classroom, I strongly recommend that you go ahead and get them into the virtual academy, VLP, Virtual Academy. Is there any other business we have to take care of? Hearing none, we'll go ahead and adjourn this meeting. Thank you, everybody.
Thank you.
good night.
Sorry.
good night. Good morning.
Good morning.